Good night, Clark TV Massive. Subscribers, friends and family.
Yeah.
Welcome.
Yeah.
A long time we not there.
Touch base and them things.
Yeah. For 1, 2 or 3 weeks.
Yeah, man.
But tonight, folks, back at you again with another discussion. Of course, we have Mr. Robert Clark from the Clark Academy. We have Mr. Ethan, also from the Clark Academy, and yours truly, Norton Weir, affectionately called the engineer. 3 handsomest men in Eltham.
Yeah.
Perfect.
You know what, tell no lie.
Alright, folks. Tonight we will be talking about injuries. How you get them, how to manage them, how to prevent them, and also how to recover. Alright, so stay tuned as we talk about this topic, alright? Gentlemen,
Yeah.
it's a pleasure to be back.
It's a jive. It's a jive.
Yeah. Sir Clark, injury.
I'm here start tonight again.
Yes, man, you always have a start, man. And you people ain't come to see, you know.
Yeah.
Yeah.
Aye, football and injuries. Football is a close contact sport.
Yeah.
So
It is a contact sport.
Yes, it is a contact sport. So we understand, say, things can happen when you play the game or even when you train. You know,
Yeah.
you just do one little exercise and you stretch a muscle or something.
Yeah.
How often you see injuries happen, Sir Clark?
Alright. On the topic of injuries still. Injuries are 100% a part of the sports as not being injured. So over a period of time, you're going to injure.
Yeah.
Right? Because the mere fact say, I believe that you're injured from your blood eating.
Yeah.
Right? Because your blood can carry a certain condition,
Yeah.
a certain type, and it can affect you by just movements and these things. So blood is an aspect too, but it have to be properly managed, right? Make us speak specifically towards a footballer in terms of with playing still.
Alright.
With surface is not the best of surface.
No.
And not even near good.
Not even near.
Mere like we average our we play upon the worst of surfaces then. So you know so that a main recipe for injury alone. Just if the ground will
Type
run
of
up and
ground,
down
yeah.
pound per day. Right?
True.
Even the professional with the grass, the professional who play upon the field with the grass, standard 4 inches thick and all these things. Remember, in our country, Jamaica, we don't have them the legacy there. And even if we best field in Jamaica, still not qualify.
Still not even second grade.
Yeah, any field where you can hear them talk about in Jamaica, still not reach up to the international standard as such. Either it's too small, it's not properly grassed or something that causes it to not qualify.
The surface not
Or it's too
flat
tough or
enough. Yeah.
something, right? But injury is a wide range in terms of the aspect of getting having injuries.
Okay. Any other factors? I mean, because you mentioned something we never even consider, that the ground alone.
Yeah.
Yeah, factors, and there are other ways you can get injuries, you know, differently from just the surface, the positioning of your body.
Yeah.
When you're receiving a ball or when you're moving off, because sometimes when you say to a player, say your pivot foot, that's your landing foot.
Yeah.
That's the foot that's going to keep your balance when you use the other foot to try and control the ball. If that one is not properly placed, it can cause a
you
injury.
can make a slit or a slide, whatever you want to call it, and that can result in injuries.
Yeah, so it's a the field plus your landing.
It have a wide range, as I said, but we can start definitely from like all the foot itself,
Yeah.
right? When you look on if you don't cut your toenail them properly, and you put on your boots with your toenail them projected out, and a ball hit pan it, you can have an ingrown toenail. Right? So you have to go take off piece, or some people do surgery feet, but sometimes we here when this happens, we just pluck it off.
Yeah.
We just dry it off, use a fingernail clip and then something there. So we have to ensure so we toenail them properly.
Yeah. Manicured
and ready at all times.
Because if it projects over the toe itself,
yeah, it can be a problem.
It can be a problem because there's a difference between the players then, because you have some players who like the boots well close.
Yeah.
That it feels like them not have on nothing. And some people like the room where them so them foot can breathe. Right? So if your boot is close fitting, your nails have to be cut.
And not only the nail, the circulatory aspect, it will minimize the ability of the circulation. Okay. Right? You now have the effective circulation through the process of your foot. Yeah. And that can cause an injury as well.
What most common types of injury? Give me like 3 or so.
The first one that I think is muscle, like the biceps, that's the muscle behind the leg. The muscle behind the leg, it tears.
As a footballer,
often.
I may intervene a bit. As a footballer, you know, so most of the injuries them are going to be from the legs.
Yeah.
The foot. Right? You know, so the leg over a period of time, when it's under too much work, it puts some pressure to you.
Yeah.
Hamstring, your femur, these areas of your foot are going under a whole heap of pressure. So the first thing we have football have to make sure say in able to have to minimize some of the injury. This is just one aspect, is to keep your body weight.
Oh.
Right? You can 5 feet 5 and you weigh 200 pounds. You have to weigh like 140, 135 pounds. So that are some of the factors them where minimize injuries by your height, the weight according to it.
What coach is basically saying is that a person that is 5'4" and weighs 200 odd pounds is going to have a problem. And here where the problem is like, you see, when you stride and come down, the weight per square inch coming down is 3 times your body. When you step down with that weight and your height and your pressure point for your feet, it's 3 times your body weight. So you have to make sure so you maintain a certain amount of weight. That the pounding, because you go run up and down and the pounding.
And make a look on the ankle, right? You have whole heap of footballer we have ankle problem. This stem from one again, the how they fit them boot.
Yeah.
And sometimes the height of the studs.
Right.
Because if you don't have a proper surface,
you can't have the big old height.
You can't have the 3 inches in studs and then stuff there. Your studs them where you don't wear now in rain time or when snow or them things that you can't wear them on a regular basis. Right? So you have to work on that. But the ankle itself is an area where most players, and it causes the overweight too. Right? Because some footballer just believes that them to be muscular and strong. Right? But being a footballer of a specific build, we have to do with range of motion, strength.
And sometimes you don't even have to put on any exercise to get weight. The game itself shapes your body.
Yeah.
Right.
The constant training and everything shapes your body.
And next area what we are talking about, the area which part is shin guard put, where you call the shin.
The shin.
Right? Feel like all the youngsters them, when them a grow, they normally feel some pain right below their kneecap right or so. Right? It's a form of the growth spurt of your body. So sometimes you feel right there a pain you. I just either you put on a little bit more weight or you stretch a little bit in a bit.
Yeah.
Right? And that basically that's why you feel them pain a bit.
So the fundamental way and the real way is to make sure you're properly stretched before you play the game. That's one of the preventive measures that we try to exercise with the kids. Try to stretch and warm up properly, because the moment you go there and start going up and down and the muscles get cold.
And the next thing to Ethan, here in Jamaica, and our mentality as a unprofessional or a semi-professional footballer, we have a tendency not to believe that stretch, warming up and stretch and cool down and stretch is very important.
Yeah.
And it is very, very important.
Very, very important.
Right? You see, anytime you're there anywhere in Jamaica and you see a baller or see an individual who have a play football or any form of sports and you see him warm up and then him put in some stretch, him have knowledge of what is injury.
What him supposed
and him have
to do.
him have a guideline of principle where him a work from. Because most people does not do that. The kids them out here and the bigger youth them, Ethan can tell you. We have our format where we say warm down, cool down. All the time we have to tell them that. If we not tell them that when them finish play, everybody gone.
Because let me tell you something. You see, sometimes the muscle problem don't occur when you're done training. You say you go home, go bed, I'm gonna lie down on the bed. At them time that when the muscle flex, if you get back relaxed, you get a muscle pull. Because most people tell you the two worst place to get a muscle pull is in a bed or in some pool or somewhere.
And the next thing too, when I remind the people, one main injury that most people experience where people sometimes not take notice of what causes it. You see, at night time when you lie down and you feel all your hamstring or your leg draw up on you, you feel this excess pain, right? You feel this pain. I beat you down and your foot cramp up, muscle contract wally and then something there. You have to be able to press on the same area, right?
Yeah.
If I hamstring, you have to stretch out your foot and press on the area to get the muscle back in to kind of come out of the mood still. But what basically happens when that do occur, it have to do with the mixture. Water.
Yeah.
Oh yeah, the mixture of the blood, no?
And the blood
circulation, yeah.
And these things where that ensures that the circulation take place. So these things are very important for us.
Very, very important.
But on the matter of the knee now, when we are talking about the knee, well, me supposed to be a master of the knee by now because you know I'm blessed with the inside bow leg. You see me? My knees, right? And over a period of time, playing in a Jamaica, because if Jamaica have the best feel right now, for you understanding how people live in Jamaica, just think about 20 years ago, you can.
True.
20 or 25 years ago. That means a concrete we don't play upon.
Yeah.
Right? So the knee itself, right, when you have a major injury with the knee, and a normal thing. But one thing I can assure parents, and I want to listen to this keenly. If your child or children or anybody where you're a coach have a knee injury and they're underage, please me I beg you, don't surge upon their knee. You understand?
Yeah.
If the person are 13 or 14 year old and them lick up their knee or them make a twist with their knee, the best thing for you to do is to go and ice it and give the people them time to recover, because remember say it's a form of the growth spurt at the time. So if you surge upon that, the foot will never experience its full dynamics of reaching to the capacity of its growth at its growth.
Because
So
one of the terrible things we do when recovery is supposed to be specified by a professional. If the doctor give you 5 weeks, take 7.
Yeah.
Take 7 because it does well for you. So me I say the recovery time.
Yeah, and we have tendency, even when we injure, we still play.
We still
Whenever
want to
we
play.
injure,
Stay
we
away from
just
the game.
stay away from the game. But the coaches, them have this tendency, knowing them see as an important player, they have this tendency to butter you up and encourage you to play and make your injury worsen. Because
And I have a serious problem when coaches are going to play players and them say him have a slight injury. No, no injury is slight.
Yeah.
Injury is injury.
Injuries.
In a
Right.
slight, nothing and in a more than. It's injury. You can over proportion, but it's still injury.
Make the
Make
individual
the
rest.
individual rest.
Because-
And you see grind injury, very important before you're coming back, coach. Grind injury, very, very important. The only solution for that is rest.
Yeah.
Stay away from the game.
We have a
just
next thing where we
rest.
can shape on the grind too, but knowing so we reach at the knee. We want the people to understand the importance because the knee and the ankle, right, is two fundamental areas to keep you as a footballer
Yeah.
with longevity. If you can be able to take care of those well, right? So you have to ensure, say, because sometimes the knee, the ACL, all these things that they say in our knee with torn and destroy and the inflammation over a period of time can get rid of.
Yeah.
Sometimes your knee swell up and you got a doctor. First thing the doctor tell us, boy, them are going to draw water out of your knee. Nobody never put water in your knee.
Yeah,
So why you have to
imagine-
draw water back out of your knee for?
The first
Right.
procedure should be do an X-ray upon the knee to see if it's
Ice it
damaged.
first. You ice
And
it
then you
first.
ice it.
Any area at all upon the knee where really have any form of feel no pain. The first thing you do is ice it. Right? When you ice it, right, you can look towards, go do an X-ray upon it and have a clear understanding of what take place with the knee. Right? Don't get up and play back same way. Because when you're injured, you know say you're injured.
Yeah.
And you know a pain when you feel. Sometimes the coaches them force you to play, you know.
Yeah.
Right? Because most coaches, them don't like lose.
Especially in our environment,
Yeah.
most coaches dwell on results.
And the coach will really and truly loving players are the coach will prioritize the player when the player injured.
Yeah.
You can't just prioritize some players and leave out some. If it's the person are starting a team and them injured, because sometimes you know you win a league from your bench, not from your starting players.
No.
Because most of those starting players when they come on to the quarter-final and semi-final, them not go there. So you have to prioritize dealing with injuries to the entire team.
Yeah.
Any one of the player them down, you deal with it right away. Right? So these things we have to focus with energy and look and understand clearly what we need to do when it come on to knee injuries. Alright, you have a next aspect of injury where you talk about thigh. Hamstring and your thigh and these things. Now cure all. Once some is an athlete and you do plenty running, you're going to experience a hamstring problem,
Yeah.
right? Because either the muscle not warm up properly. That's one of the main things where runner or people where in a sports prioritize to not make happen. Because no cure a man well trained, he can go out on the field or he can go out anytime and right away hamstring act up on him from warm up alone, right? The one of the best method I say for that is the mere fact say once I'm going to do no extensive exercise you have to do with running and these things, I think a massage,
Yeah.
to get a proper massage or you have a massage therapist where they really sort out them area there before you play. Right? Who not have them support there. You can get little Vaseline and little lotion and massage your thigh and massage them.
Or you can use lotion with
baby
moisturizer.
Baby oil.
Yeah.
Right?
Baby oil is very good.
And rub on your foot and your hamstring and them look something that will help to ensure that these things don't happen. But there's not a clear thing where you can say to a man say if you do this you won't have a hamstring problem.
No.
Right?
You can't just pop up.
So we just talk about minimizing the risk of it
Getting-
acting up, mitigating the pain and the damage where we come with it.
Yeah.
Yeah. So Sir Clark, tell me something. You train whole heap of people, right? Football. And you mention body type and mass. And you say that injury starts from the blood. Diet.
That is a factor. But you
But
see,
it's not heavy and
Me don't want to go to if grind area still, you know.
Oh, you want to go to the grind? Yeah, I mean, if you
Me
get
not
about the
really
grind
want
area.
rush to reach towards the diet.
Alright, we'll go back to the
But
grind.
when we are look now, make we work out the grind area.
The grind area is a problem because we can tell you. Me not play whole heap of football, right? But me never had a grind problem, never. And me see kids now, 14, 15, have grind problems. And I think it's too much football, not exercising, not stretching, and not warming up properly. That's causing that.
And cooling down and stretch.
And you have to cool down because when your body reaches a certain that temperature, you have to take your time and bring it back down. It's going to cause the muscle to flex, and from the muscle flex, you're in a problem.
In addition to the grind, when you look on the grind area and oil structure, right? You know, say the protocol and the procedure to come on when dealing with that warm up is 10 to 15 minutes.
Yeah.
We include like 5 more minutes of that with stretch.
Grind
And
stretch.
stretching.
Yeah,
We have to do with the central area of your body. Most people don't have the time to do that. They don't see it important. But I say the dedicated player, the professional minded player, or the professional player, they will prioritize that because they know the importance of it.
Yeah.
You have so many grind stretch where you must prioritize. And sometimes I can tell you an area, certain things that can cause grind problems still. Right? You will have some of the youth them have multiple girlfriends. Right? It may sound a weird to you, but it's a factor as
It's
well.
a factor.
Me may not have the scientific proof to it as such, but knowledge is power. You see, if some of the ball of them have unprotected sex, right, then can catch infection, and sometimes the infection seem like a grind problem, right? So it's best when you have a grind problem, you have a doctor and everything there.
Yeah.
Enough people not aware of those things.
It's that
Right.
sex first.
And normal is a next aspect again, and whenever you have a play, right? You know, just wear a tights, right? Wear a tights. If you know your customarily don't have them ears problem there, wear a tights, a close tights. You know, must have to wear now. Well, recommending the underwear is good, but sometimes you wear your tights without other underwear. For the female, it's a bit different still.
Yeah.
But for the male, because at some point in time, he used to wear tights and not wear no brief. And I did it still, right? But that is some way when me don't look on to say and protect me and help me with my grind, right? You have a next area, the pelvis area, right? You have some people, when most people don't have back problem, right? I just all want to be in a shift for the disc,
Yeah.
right? Or your pelvis area make a little bit in a shift.
And it all comes back to positioning.
Yeah, so you see if you do your stretch in a proper manner by warming up, and when you finish your cool down and stretch and these things, it will help if anything out of line at the given time.
Yeah.
It can be able to come back in, right? Because sometimes you get a heartache, you know, and through your blood so warm and you know your eyes height and then
And when
you know
you come
realize
down
it.
and
But
get
when you cool down now, you know, so
you start to
boy,
feel the
you
pain.
start feel the pain,
Yeah.
right? And these things are very important for you to look into as footballers.
Another thing we never touch about the ankle. When in cricket terms you call when the ball boom you call it a half volley or a full volley. In the game that we are talking about, the instep after lock. That means when you stretch out the foot, the instep have
Lock
to
it
stay in
firmly.
one place.
Yeah.
We kick that ball properly. Because anyhow the
When you're
ankle goes
striking
up,
through the ball.
when you strike through the
But
ball,
you have some flex kick where you
right,
can
the
use, you know,
instep,
but when
the
you have
instep
strike
have to
through,
stay
you
one
have to
place.
lock the instep and follow through with the
And
kick
follow
with
through.
certain kicks.
But if it flaps sometimes,
Yeah,
if the ball catches the front part of the boot,
you can feel a sense
you
of
can
pain. You
feel a sense of pain. If it catches it in the middle, you know, only thing will happen, you know, either I go high or the ball just go away. But once it catch down at the toe point, and the foot no lock, the instep no
Yeah,
lock,
man.
it can cause a
Can make some adjustments
Yeah.
another year.
it can cause a whole heap of problem.
But as I mentioned in terms of with the grind still, you have to, and the pelvis area, right? Any form of shift. That means it show you how important the stretches them is.
Yeah.
So you have to prioritize stretches before you go and play. And when you
And
finish
when you
play,
finish play.
you make sure you stretch again and stretch properly. Okay? Because like all the back, when you look on the back, as I mentioned to you, any little area can shift the back. Right? Because the back is very delicate, you know. That's why one of the main rules in a football is that nobody not tackle you from back.
Yeah.
Because that's one of the most delicate area
Yeah.
for your body where can
Be a life-threatening
injury.
injury.
Right?
Neymar was lucky in one of the World Cups with the Colombian knee in his back. Very lucky. It's because the person catch the meaty part of his back, not the central.
Yo, if they never catch
If they ever catch the central part of his back.
And Neymar, you don't hear about
Neymar.
Yeah. Yeah, man, so them area
Very
is very,
delicate.
very important. The next year, you know, what we are looking like always shoulder.
Yeah.
You know, when your shoulder, you drop on your shoulder and you drop bad, trust me. Normally when you play and certain things happen to you, you blow it off, you just brush it off and you go again. Because it is not in your nature for you to just give up easily.
And there's a thing where you have to learn to concentrate right through the game. Not only to play the game, but to make sure say when you fall, the hand not set certain way.
But Ethan, sometimes, you know...
It's difficult.
Yeah, it is.
It's very difficult, but it's something that you have to practice.
Because as a
Or
footballer,
keep in mind.
you have to learn the technique of the post. You
Yeah.
know, it may sound cruel still,
Yeah.
but if you want to learn of it, break your fall. Even your little kitty where you like so much, you just hold him by them pair of foot there
And
throw him up in the ear. No, not throw him up by yourself. That's not too wicked. Throw him up in the ear.
And see what him do.
Yeah, just like all even one, when they say you get an original clocks.
Yeah.
You know, say you throw up that the clocks in the ear, you know, and clocks drop on the face, you know, but I say you're not original, that, you know. That, you know, man. Clocks have been drop back for foot bottom and solid.
Yeah, solid.
And solid.
Yes, man. Oh, yes, man.
But it's very important for we sort out and dealing with the injuries and still. Right? I don't know if you want me address or dealing like all with the... Alright. When it come on to like all the belly, for coaches and for people who are into sports, remember, if a female have a belly problem before them play or them feel them belly, they will understand if they can go through it, right?
They can understand.
They can understand that.
let me
But
tell
if a
you,
year a male come,
we have full experience of that.
Yeah.
We are a female team. We don't have to mention the name. And we went to a certain part in Jamaica to play. It was Jamaica Women's Premier League.
Yeah.
We were in charge of the team.
we'd have a Mantico bill.
Yes. And nearly 7 of the players, of the female players, 7 out of the 11 had their monthly
At
thing.
the time.
And we had to make sure that we interviewed them one by one to make sure, say, can you play? And they did play.
And you know, so we as male, we're not going to get a full understanding of that.
No, we can't.
But we have to put it to them.
Yeah.
Yes.
And nobody believes that we are going to ever get it. We are not going to get it. So you have to give the female the option of deciding whether or not they are going to play.
Yeah.
Right? Because the female is very determined, just like how you said the male be, in order wanting to play. Right? So when a male now have you hear a male come and say belly are hurting or in head are hurting and then something there. It's
Can
best
be
for you as
drastic.
a coach to make that player sit one side.
Yeah.
I don't play that.
Because
player.
everybody in a society knows, say, once a man start feel pain in turn baby,
Yeah.
right away.
Yeah.
Woman feel pain and do their work and me don't know how them do it. Me now go ask.
You're not going to be able to figure it
And we
out.
can't figure that out. Women a feel pain.
Right.
Them even make song of fighting us. Woman was born to feel pain and all these things.
But Ethan,
But
when I look upon it in terms of with the football, it clearly show you how the rules set up with the referee.
yeah.
Once somebody get a belly, when him hold up in belly or
Yeah.
head,
Yeah, very,
you
yeah,
know,
very,
say,
very, very,
right
very
now with the
different
stretcher
part.
come on.
The
field,
head, the
right?
back, the belly,
So it's,
and the groin area.
yeah, right?
Them the area.
And to be honest with you, still in nothing. The food itself, it don't just able to help the recovery,
Yeah,
right?
that's what the food does.
But Ethan, in some cases, again, if you're not getting the right food and you can't afford the right food, it's still going to be an issue because
Still gonna be
right
an
now the food that we have access to is these food are chemical preservatives and number one
Yeah.
thing we're in them. So a man carry one apple come give you and say the apple or the banana. By the time it reaches down in your stomach, everything black already. You get me? Pure chemical and preservative.
Yeah.
So even you still have to contemplate when it comes out of
what
food.
how to balance yourself
Right?
when it comes to dieting as a professional.
Yeah.
Because you know, we know that processed food not
True.
really good for footballers. But what can we do? Some
If
of the
we
foods
can't
that
afford it,
some of the foods that are good for us,
they are very expensive
they're
in the
very
market.
expensive. You see me I say? They tell you what to eat or what it, but sometimes it's unreachable.
But I can
because
tell
of-
you,
Yeah.
for the purpose when it comes on to food, we're dealing with sports, right? You see porridge and soup, make that be a priority.
Make
for
sure
you.
that be a priority.
Because all our great people, all our great athletes, we make all these great things happen for Jamaica
And
and
this- and
Jamaica.
that was their base.
These two food are the two types of food where we prioritize.
Yeah.
Porridge and soup.
Yes, porridge and soup.
Porridge and
So your
soup.
You get
peanut
me?
porridge, your banana
Your
porridge, your
banana
plantain
You
porridge.
can
porridge.
use the porridge.
Can't
If a
be.
porridge and porridge,
If a porridge
No problem.
with porridge,
Yeah.
it's still porridge.
Yeah.
Porridge, yeah.
Yeah.
so it's very important.
Very,
porridge
very
and
important.
soup.
So what about your chicken?
You know, the porridge and soup is very important.
Yeah.
Very, very important.
Right?
Something vitamin.
Supplements should be given with instructions, and it have to be a healthcare provider that's going to tell you if your body is short of calcium, vitamin C, or whatever. We can only encourage a player. You take your tablet if we know that you're supposed to take it. Yeah? And sometimes some of the things that the food that can give us the calcium, we don't even know them.
All right. Me have a take on when it come on to like all them aspect this thing. Because sometimes, you know, say, vitamin, when you look on vitamin, right? Because enhanced supplement are mostly these things where target the blood. Because I can recall one time when me I play like in A-League, me have a teammate, me not call his name. But before we go up on the field, me don't drink a flask of rum with all 3 Guinness. And me I tell you, say, seriously, Ethan, when you
Yeah.
go up on the field I talk to him, man, he come like a man don't know me. Right? Or me able to play with the man, I have to watch the man movements and play fetch from him.
Yeah.
Me have to make a necessarily adjustment. Because those things target directly to the blood.
Yeah.
Right? When I next look on vitamins still, because I know really much where vitamins are for all the hear people at all. Because whatever your body's shorter or not have enough vitamins, when you take it will motivate your body to
Yeah.
desire those foods
Right.
to give you that. So if you find yourself down, get up and you just find, boy, I want a boom. I want
A special.
a special
Yeah.
and these things consist of sweets. So you know, say your body go lack of energy, so you say, boy, you want some energy, you know. So them things you have to go target.
And sometimes
Right.
some of them where you take up and say, you're going to deal with as a supplement for you.
Yeah.
Really not help you.
But there's not much when it comes on to vitamin. You hear people have come and tell us say the silver this and the farmer that and all these different names of pills we have to do with vitamin and them thing there. Trust me, you have somebody take all one of them vitamin pill and them say, boy, the vitamin good enough. I put on some breed and neamin. Me near feel whole day because I should be take the vitamin, you know. I don't know.
Yeah,
And some of them just give you appetite. Some of them just give you appetite.
What me appetite?
Yeah.
No, you train your mind and whoop your own appetite and think say vitamin do that. You get me? Because when they tell us that the vitamin don't really do nothing. It only encourage what you don't have.
So what we normally do is we as coaches we have to research foods and what it does for the enhancing of the player. Yeah?
But we in Jamaica have a problem, Ethan.
We have a problem.
We don't have access to a food
right
in a right and proper way. The professional players, them when people say
because
we are earn millions of dollars because the more money you have, I better you eat. Right? You see the poor man where you say no have you can come in from work or come in with hungry.
Yeah.
And you cut up one piece of lettuce, give me one piece of tomato. How much that can work out?
I war that. That
You
piece
cut
of cucumber.
you cut out 2 slices of bread and fry an egg.
Tomato.
you come in and lift up cover and say
2 slices of bread.
lettuce, tomato. A problem that. You want to come in and say 3 big dumpling and dozen banana and 1 big piece of yellow yam
And fish.
and one chop off leg off of 1 goat.
Food never cut it down.
The food never cut
you
it
see,
because we are not
if you
cultured
can
that way.
afford, if you can afford,
If you can afford it.
you eat different from the man when you have it. Right? Because I can recall when me used to do like all me look at street jogging to keep up the stamina rate. Because enough people don't understand. You have to jog for half an hour up to 45 minutes to build up your stamina base so you can be able to execute the speed or the sprint way inside of you. Right? You can't just get up and just say, boy, you run 100 meters. You have to have a stamina base where the speed comes from. Right? So you see, if you see a man get up and him a jog every day and them look at something there, you find yourself you have to drink plenty water and you have one and you have to drink your milk.
Yeah.
Again,
Milk.
me want people to understand. So when you pass 18 years old, all when you have the coat inside where white a drink from, it cannot help your bone.
No.
They say that to us. They inform us, they do everything from a commercial aspect to encourage us say milk and these things good for you. But these things good for the bone. And when you pass on the age group, your bone itself.
Yeah, the bone starts to shrink after the age of 30.
Yeah. But people they don't want you to understand say boy you have to drink your milk same way. But sometimes I beat the milk, you know.
Yeah.
Yeah, sometimes I beat it still.
And all depends because some people can't drink milk.
Right? So you have some whole heap of aspect in terms of with
It's a wide
injury.
base. It's a wide base.
Where we can cover a lot tonight. But as it go along and we mention the areas then we have to do with the injuries then. Right? Alright, you have a next format again where enough player we have like called headache and go play football.
That's a
right?
no-no.
Why don't cause your headache? You have migraine headache, you have migraine issue,
Stress.
right? You're going to find yourself eat too much salt, something with too much salt, or too much sweet, and before you go play, because give and take 2 hours by consuming your food and then think that before you're able to prepare your mind or something to start play physically, right? And you have a person who don't know where this headache come from.
It just come.
Right? It just come there and them thing there. Sometimes you don't have to play because you cannot send some message with different thing we have in your head where you don't have no knowledge of.
Because the body has a tendency to send you warning signs.
Yeah. Because
some of just
enough
ignore
players drop down, you know, so enough people not talk about these things, you know.
Because you have to have a track record.
Yeah, enough people.
Every player where you say drop down and him have to take him off of the field, he had a track record leading up to that drop
and
down.
enlarged north as well.
Yeah.
Large what?
enlarge in heart.
Oh,
Sometimes
enlarge heart.
yeah, enlarge. Sometimes these things happen with players.
Yeah.
But
You have
you
red tape come down the line and show
them
you
ignore
it.
them ignore all these signs most of the time, and we do it cause other people problem. Because you know yourself.
Yeah.
Right? And you come and amongst the coach. And the coach say if you're alright. Yes, coach man, I'm good man, I'm great man. And when the coach put you on, your mouth start jump frat, all these things start happening.
Yeah.
Right? When you could have just simple say, coach, may have a headache, you know.
Yeah, coach,
I'm not
belly
feel
not
so
feel
wonderful.
good.
The players don't have to be honest with themselves more time. Because sometimes we know you can chance and play, but I know all the time it have to work out.
No.
So sometimes you can save on yourself and save on the environment,
And
save
save
on
on
the
your
club,
life.
save on the life,
Yeah.
save everything. By just sitting down
And talking.
and just lower the physical playing field there.
Yeah.
Right? Because if from you little bit you have this consistent headache while you're playing,
Something is wrong.
there are different things that take place in your body.
Yeah.
And that are from the blood. You know, the heredity aspect of it.
Yeah. And the heritage culture, our family training.
Yeah, so
So
these
you-
things are reality. And that the injury with the blood come from.
Yeah, so it's a knowledge is power circular.
Yes, I.
Yeah, man, good. So, in closing, gentlemen, we want to encourage the people them to do when it comes to injury, minimizing them. I mean, we cover them a lot. We cover quite a bit.
Yeah.
But when we summarize them,
Alright, my recommendation with a player, a footballer, if on a day-to-day basis you go to hard training and you can afford to even have a jump where you can buy some of the party ice them and throw some water upon it and do your one little ice bath. If you know you're serious about any sport.
That shocks the muscle.
That can help
That
a
can
lot
help a lot.
in terms of your recovery and your muscle growth. Right?
the whole icing thing.
Yeah.
Yeah.
Well, me don't know in a some of the cold country them how them go about it, but then still have
You
it
don't just go
still,
chuck off in the lake.
right?
Dig
But
one
that's
hole
one of
in
the
the
main
ice.
thing, right? You have to look on, try get people or get somebody where you can trust. They assist you with massaging, especially your hamstring
Especially
and your
the legs
thigh.
them. Yeah.
You try get somebody before you go play. You know, get somebody we have a knowledge of massaging.
Yeah.
Because you know if you have no specialized men,
You
you
just-
can just
you
use
just
some
know.
Yeah, because of the
baby
pressure.
oil. Yeah.
Just
And-
apply the pressure and know
Yeah.
exactly what you do.
Yeah.
Because the massage help with blood
And
circulation.
remember again, when you massage the muscle groups them, massage them to all them shape. Right?
And you don't massage up
Yeah.
when you massage in your legs. You massage down to your ankles.
Because they say
Oh.
aging not start from short, you know, and growing start from, you know. I remember one time, you know, I was one of the quickest baller in a second catching
Yeah,
the
but
sun.
me know
When
that,
me I
me
tell
know
you, say, oh, no, can't tell.
Me know that.
As I say, ready, pop, me gone. And me start get some dream. Say me I run and can't reach the area. Me start playing people and say, but Bulla, you know move. Now I realize say old age that start jumping, you know. And my foot bottom now start hurt me. Right? And me look at my coach and me say, coach, why me not think me can manage to deal with this thing, you know, because my foot bottom hurt me. Coach said to me, say, don't worry, Bulla. It's a part of your aging process. So me young lads share these things to make you understand clearly the importance of understanding which
Your
part
body.
you're at and where
Where you're at.
Yeah.
And where
Right.
you can reach.
And the food,
Yeah.
soup and porridge.
Emphasizing it.
Look there. Look how me look young for my age.
Yeah, man.
Right? To be
So-
honest with me.
And porridge.
You see me? Me now have to mention my age again, but me over 50. Right? And my main food is soup and porridge.
porridge.
If it's not soup and porridge, trust me, it's porridge and soup.
For the same thing.
So don't forget this.
So we just have to just maintain the simple things.
Ethan,
to avoid-
I want to cut you because I don't want to forget the stretches.
Yes.
The importance
The
of the stretch.
important is
You
very,
cannot
very
get up like all me there now and me I go play football and just get up and do two stretch and say me ready. No. the blood need to start
The
circulating.
blood need to
So one
start
little
circulating.
jogging, one little thing, even some push up at the time or
Yes,
something
stretch
we are
the
going
legs them.
make the-
Okay.
Yeah.
I see.
You know, just
Yeah.
get up and stretch and say, boy, you just get the body warm up and then a stretch.
And make sure you get the ultimate out of the stretching.
Yeah.
If you have a stretch, we touch one foot.
Stretch
make
on your
sure
toenail.
Stretch
Yes,
your
yes.
toenail. Make sure the other foot is straight. Too.
Yeah.
Because if you bend, you're not going to get where you want out of it.
Stretch from your toenail to the last strand of grey hair.
Yeah. Emphasize.
Excellent. And also, folks, in stretching, in warming up, it does not pay to cheat yourself or make no
No.
shortcut.
Excellent.
No, no shortcut
Excellent.
in a
Because you're only doing damage to your body.
Thank you very
Further,
much.
you know?
And people, knowing say we know the boat be a long look
Yeah,
session. Me
but
have some
that's-
people who want big up.
Yes, make we big up.
Mr. Kennedy, big up yourself because you believe in my program. You know, you're my one-time boss and you support Clark TV, right? Big up my Georgia family from Savannah, Tamika, Sharon, right? Great, great Johnny, the wisdom them. You see me? Big up on yourself. And big up Elton Park people them.
Yeah,
Big
yeah,
up
very
NWC
important.
people them.
Yeah.
Big up all the people them who support Clark TV. Big up my family.
Yeah.
Big up my friends them. May I throw over some 1 and 2 big up over my enemies still, although me know say from me is not much. But anyone who go they can spread for all 5 or 6.
Yeah.
You know, if there's so much.
Yeah.
But we just big up yourself. And remember, in this video have a little bit of time with it. Put down the phone and listen to it consciousness. It will
Yeah.
help.
It will help a lot. Yeah, we don't have much big up, but we just have big up my family, the McMorris family and
Yeah.
the Nicholson family, worldwide. Big up my friends them and people at Eltham.
Yeah.
I just much love and you know.
For real. I mean,
Clark TV
I mean,
forever.
I left you out in my spam. Big up yourself too.
Yes, man.
Because you're there for we and our kids them.
Yeah.
Because Miss Spam, trust me, I am saying this to you. You wouldn't understand how important all them bag juice you be. When them youth are get it when we are training morning time.
True.
They look towards it. And you commit yourself and support us in giving us these things for the
Yeah,
kids.
it's a blessing,
Oh
man.
gosh, man.
It's a blessing.
Right? And thank you again.
Yeah.
Yeah.
Good night.
Remember to
Subscribe as a blessing.
like, share, and subscribe. Till next time, folks, we have another interesting topic for you, alright?
TV signing out.
Signing out.